I just want to show you, you got to find somebody with good reflexes to start with, okay? And he claims to have good reflexes. So my idea is, just a second, okay, so he's got to be in the picture mainly, and I don't have to be fully in the picture? Okay. Are we doing okay? All right. All right, okay. Just pay no attention to these people on the side. Okay, this is okay. Okay, what I do first of all is I find out where the tendon is. So can you push up here? Okay, I find the tendon and now relax. I put my thumb on the tendon and then I whack my thumbnail. Okay, so when I whack it, I can feel the tendon tense, so I get that input. I can also see the movement. It's pretty quick. There's not much doubt, and I just don't do it once. And I don't do it this way. Like Dr. Body was saying, I hit it and release. I just want to see what happens if I quickly shorten or lengthen that tendon. And the central nervous system, peripheral nervous system wants to keep things the way they were. So if I make it longer, it's going to shorten it a little bit. Do you understand? So that's what we do. And then I go from one to the other, and I can do the same thing here, and I get the same kind of response. And I do it a few times, that's fine. Okay, then for brachioradialis, this one hurts if you hit the bone itself, so I want to hurt me first. So I just lay my fingers down here as lightly as I can. Am I pushing hard or just, it's very light, and then I do that. If I want to augment this, clench your teeth, clench the fist. Now, and I get a bigger one. And I may be hitting it bigger just to make it look that way. Okay, now relax. So then I do it on the other side the same way, and I try to do this as equally as I can. So I may get in the same position over here and do it the same way and reposition things until I get, now make a fist here and clench your teeth. And then I get the same, this one may be a touch less than that, but I'm not worrying about it. Pardon me while I get out of the way here, but this is a good way to do there's lots of ways of doing the triceps. It's a short tendon insertion, so you have to find it. And once you tap it, that's very good. Another way to do it is let the arm fall. So if I let go, no, you gotta let it fall. So, okay, it's hard to just relax, but, and then I just hit here, no, you're helping me. Okay, this is one way to do it, but if you get a better response this way, don't hold your arm up. I'm doing all the work. Pretend you're in coma. So I can see this. So he's good at pretending he's in coma, I think. All right, you see, so this is basically, if C5 is out, you lose the biceps. If C6 is out, you lose the brachioradialis. If C7 is out, you lose this. Now there's 5 and 6 in both of these, but that's general. And he may have pectoral reflexes. So clench your teeth and clench that side. And it may be a little bit, but I'm not sure what I'm getting at. Who cares? Okay. All right. So there's a couple ways of doing this. One of my favorite ways, if somebody is laying in bed, is I'll just do this, and I'll just pick the legs up. Pick up the knees. No, you got to keep your feet on the ground. And then I can go from one to the other really easily. And he's got suprapatellas as well. So this guy is really...
I'm a jerk.
No negative self-talk. That's not for the attendings to do. Okay, so that if I want to look for, let's say, a beat or two of knee pronus, he might be a good one to do this on. Just relax. I just push down quickly and I don't get anything. So I want you to clench both fists and your teeth and try to relax here. I'm not getting anything here that's abnormal, but let's just see. So the reflexes, you can see how we do them. And once you get it, you can just move on. And is it okay to have 0 reflexes? Yeah, I think so. Is everything else is okay, as long as you don't have a problem? Is it okay to have a little bit of clonus? Well, maybe 1 beat, but not too much. The other thing I do sometimes if I'm in a hurry, if I got somebody like this, this may not be kosher, and don't do this on your, well, you don't have oral boards anymore, but if you just do this, you get the same response there. A better way to do it probably is to dorsiflex the foot a little bit, but not too hard, because if I go like this, I'm not going to see anything. I just want to tighten the tendon. Don't help me. He is a very helpful individual. And you can see, yeah, you can see that he's got good responses on both sides. So if I want to check for a little bit of clonus, I can go up like this. I get one beat, and that's about it. That's okay. Another way to do it, he's embellishing. Don't help me.
It's functional.
Is I can do it this way if I want. You know, again, if somebody's got a cast on, you know, let's say somebody has a cast on their leg and they only have these, there's another Babinski sign where you take a sharp object, or you take a tongue, not a tongue blade, you could do a tongue blade or a cotton applicator and just tap here. It's what's called a Bing sign. So if you tap right here in between the first and the second toe, but not up at the toes, if you get an extensor response, that's the same. So I remember one guy coming in and I thought he had hyperreflexia in that arm, and when I tapped him here, sure enough, he had a Bing sign and a Babinski sign. So I think we found out later where the lesion was. But okay, now let's have you take off your shoes and socks if you don't mind. Any questions on this? So the main points are, make sure you have your thumb on the tendon. You don't need it here and you don't need it there, but in the upper extremities, at the biceps and brachioradialis, that's a good thing to do. Certainly here, when it's sometimes a little hard to get. Okay? All right, so for the Babinski sign, first of all, while I'm doing this, I'm again doing straight leg raising signs, and he doesn't know it. I check the turgor. He's got good moisture on his feet. He's got good hair distribution. I'll check for pulses while I'm here. It's just a routine I get into, and hair distribution is quite good. So what I begin with is there's a Chaddock sign that you can do this way, and if you get a good response, it's not ticklish there. And I go with it, so you're looking for the big toe to come up and slowly come back down. Sometimes there's what's called a triple response. People will do this. And in fact, the story goes, Babinski wasn't the one that discovered this. It was the nurses at the Salpêtrière Institute, because they had people with paraplegia, and they couldn't get the patients to lift up their legs for changing the sheets. So they would stroke the feet, and the patients would lift their legs up, and they'd very, very gradually bring them down. And Babinski off in the corner is, I should probably light this up. You know. So if you can't get a response with a mild response, you may be a little ticklish. Is that true? Okay, well, I shouldn't enjoy this too much, but I don't like, what I like to do is, can I borrow a tuning fork, please? Because I think the tuning fork has enough of an edge on it to be a little irritating, but it's not. This thing could cause a slice.
You can borrow a real reflex hammer in here too.
That's okay. I just come up this way very slowly and come over, and I do it again. Okay, and then that's enough because he's starting to go down. If I don't get anything, I'm done. I do the same thing on the other side. I go through the ritual of checking out the skin turgor and all that stuff, so I pay attention, and then I do something mild here. Why don't you fake a Babinski for me? Can you try to do that? No, I don't give you I don't think it's, no, come on. No, try to get this toe to go up individually and then fan it. There you go, now fan it. Now you got a fan. Now you got a fan. Okay, there you go. So pretty soon, you know, he can probably get a little bit of disability. Any questions on that? All right, so practice and we'll be preaching to you at the same time. So any questions? By the way, reflexes are really good because You can do them on an unconscious patient, you can do them on a patient that's not cooperative, and it tells you a ton if one side is different than the other. You've got to explain that. So, okay.